Now we'll hear from Dr. Kristy Sanderson from the Menzies Research Institute, who has been studying the health benefits of participating in work to people with depression and anxiety.
Thanks very much, Michael, and thanks very much to the NHMRC for this opportunity as well. I think what I'm going to talk about in this next couple of minutes will resonate with all of you in this room. I'm talking about a study we did to try and understand the pressures and consequences of continuing to come into work when you're sick. I'd like to look around the room and think how many of you have done that recently with a respiratory infection, whatever it is. How many have thought, oh, I've just got to get in, I can't afford not to work. What we did was try and understand how these complex decisions are made and their consequences for people who are dealing with one of the most common chronic diseases, which is depression. So I'll say that everybody knows the stay-at-home rule for respiratory infections, even if I'm sure most of us don't follow it when we know we should. But when we think about a disease like depression, while it's not infectious in that sense, there's actually some evidence that the lost productivity from working when sick can actually be infectious in a sense, in that continuing to drag yourself into work when you're performing below par can actually impact on your workplace, and particularly when you work in teams. It can actually affect the amount of your output and how much work you're able to get through. A few years ago when I started thinking about this, I would repeatedly hear at conferences and other forums on depression and workplace health that we must keep people coming into work with depression. It's absolutely vital because that's what keeps them going, the routine, the structure. And repeatedly I sort of put up my hand and say, but what's the evidence base for this? We know that damaging workplaces can actually be contributing to poor mental health. Your recommendation could actually be worsening somebody's health. What's your evidence? And they turned to me and said, well, you're the researcher, why don't you go and get us some evidence? So I thought, okay, well, that's fair enough. So we were really starting from a point where there was active promotion of guidance being given when there was no evidence to tell us how that was harmful or when that might be beneficial. And we were particularly interested, particularly in the workplace scenario, where something may be beneficial for a worker but may have consequences for an organisation, and how do we actually balance those things? So this is a list of pros and cons of working and taking some short-term absence, which I'm sure most of you will resonate with. We wanted to try and capture the full spectrum of what could be going on. We know that someone coming into work with depression, there's a range of positive things. An income for people who are paid on when they only turn up and work. The opportunity to keep their job and keep their hours. They do have some productivity. It gives routine, social support and improved mental health. Again, if they absent themselves, there's also some positives. Time to seek treatment, and that's a really important one because we know that access to treatment is still too low among people with depression. Chance to retain an employee because they're seeking help, and potentially removal from a stressful environment. But if you have a look at that list of negatives, for both of these options, there's a clear range of consequences that could impact on both the health and productivity. So because, as you can imagine, thinking about this is a very hard question to test with a randomised controlled trial. It'd be very difficult to get an employer to agree to this. So what we did, which is quite common in the epidemiology field, is do a cohort simulation, which is we took all the evidence we knew from published studies, epidemiological studies, literature reviews to tell us what this possible range of consequences were. And we mapped a simulated cohort in the Australian workforce over a number of scenarios. I was actually quite pleased to be able to report back to my advocacy colleagues who'd been promoting this need to work, is that actually when we put all of it together, we couldn't distinguish any overarching negative impact of continuing to work. And for us, that was an extremely important finding, that we were actually able to put some evidence behind a recommendation that was already out there. There's obviously always some caveats with this. If you're in a situation where your work is actually contributing to your mental health, that's a different scenario. But overall, we were able to say that what they were actually recommending actually did have some evidence behind it, so that was quite nice. And just in terms of where we're going with this, as I'm standing in NHMRC, which is increasingly focused on translation, which is wonderful, I just wanted to give you an idea of where we've subsequently gone with this work. We've got a couple of studies directly working with employers about how we can encourage them to provide better and more supportive environments to support their colleagues with a mental health problem. We're working in a study with small business, a very neglected area in terms of workplace health, a Business in Mind project. We're working with the Tasmanian State Government in a whole of workforce, workplace health promotion intervention that they are rolling out, we're looking at what's being done for mental health. And we're also looking at some particular chronic disease groups, like how can we promote positive return to work experiences for people after a heart attack who are trying to manage their mood. How can we support someone who's caring for a person with dementia to stay in work, because we know now that that can have benefits. So thank you, and I'd just like to acknowledge my colleagues. A lot of this work was done by a PhD student, so we think this is very exciting, particularly for her, Fiona Cocker, that she's had an opportunity to feature in this publication, and also my colleagues at Monash and Queensland University of Technology. Thank you.